Let's get started. Hello, my name is Schaefer Jackson. I oversee the research here at Class Research that we are conducting in virtual care and remote patient monitoring. And I'm going to present on moving from telehealth as a necessity to telehealth as a strategy. And first I want to look back at what we saw as a result of the pandemic. You can see some of the telehealth usage over time, and this was during the chart you see on the left there is a chart we put out as a result of COVID. Prior to the pandemic, obviously low adoption of virtual care, very high adoption during COVID, and some sustained adoption after in Telehealth 3.0. One thing I want to point out when we get into Telehealth 3.0 is you can see the stabilization that we predicted after COVID, after we saw kind of the decline. But I think we want to replace stabilization with strategy. And I don't think we're really seeing stabilization across the board. We do have some stabilization in certain areas, but strategy is probably a better word than stabilization as we look at telehealth moving forward. The other thing that we see as we look at telehealth, we have reached out and asked patients about their telehealth usage. Do you anticipate using telehealth again? Do you anticipate using it if you didn't use telehealth? And so in our patient perspectives report from 2022, those that had used virtual care as a modality for care wanted to use it again. In some cases, they wanted to use it more. And those that hadn't used virtual care, a percentage of them also wanted to use virtual care moving forward, although some you can see didn't want to use virtual care moving forward. But you can see an appetite from patients to have virtual care as part of their care strategy moving forward as well. Just to give a sense of some of the use cases we see now from telehealth, the status quo as you see there with the orange box, the orange call out, that's some of what we saw in the video visits that patients mentioned in the slide before. Some of the other use cases that you see here are areas that providers have expressed interest in pursuing moving forward. We'll talk a little bit about virtual inpatient nursing coming up in subsequent slides, but things thereafter, inpatient telehealth use cases, group functionality, interpreters, giving access to more people, and as you can see those top two bullet points, those are settings that are in the hospital. So leveraging technology, not just for patients that are at home, want to connect with primary care provider, but leveraging technology in the actual hospital. So the current telehealth segments that we have, that we rate, virtual care platforms, video conferencing solutions, and EMR-based telehealth. And I've just listed a few of the reasons why some of those solutions are selected when we talk to providers. So virtual care platforms, those are broad platforms that are used across the enterprise oftentimes, tend to be more complex. Sometimes there's hardware involved, sometimes there's physician services that are offered as part of their offering as well. Video conferencing solutions, those are typically more on the outpatient setting, easy to use. Group functionality are why they're selected, tend to be more one-to-one, sometimes they're family, but group functionality, as we saw in the chart before, was something that providers want to see more of. And then EMR-based telehealth solutions. These are, of course, solutions that EMR vendors offer. Of course, integration comes up as part of why they're being selected, and ease of use is another factor there. One of the things from our recent telehealth report that we've seen is energy from the EMR solutions to be selected in those outpatient settings. So you can see some of the solutions that were replaced in that x-axis and what they were being replaced with on the y-axis. And you can see some of the cross-industry solutions being replaced by EMR solutions, as well as some of the healthcare video conferencing solutions being replaced by EMR solutions as well. So that's a trend that we see. In one of our previous reports, 69% of organizations would look back at EMR to see what their offering looks like moving forward. So we are now seeing that trend as we reach out and talk to provider organizations. Some of the things that maybe are Opportunities for improvement as you look at virtual care. These are some of the things, is this type of visit the right visit that we should be using for virtual care? Can I see a doctor or nurse faster? Am I getting the right link? Am I connecting with the right doctor? Those are some of the things that we see where patients want to have that improved experience, and some things that might, moving forward, inhibit some of the adoption of virtual care. One thing, that we've seen, Class co-published a report with Bain in the last little while recently, and one of the things that we saw, and this goes back to what we see from organizations going to their EMR vendor and seeing how their solution might fit into their strategy, you can see one of the things that we see is providers are increasingly looking back at existing solutions to carry out their strategies. I think this is particularly applicable in the virtual care space, and part of some of the areas we see that they might be looking to expand into. Of course, behavioral health is by far the number one use case we saw from a virtual care perspective. But if you look at some of the other areas, that gives you a sense of where providers might be looking to expand with some of the vendors they already have in place. And you can see with those categories, they do also map to some of those inpatient potential use cases we saw providers are interested in before. So psychiatry, stroke, cardiology, endocrinology, some of those tend to be more acute and more in the hospital. And so this just gives us a sense of where energy might be moving forward for virtual care. This is also from that publication we put out in concert with Bain, some of the types of organizations that are more inclined to look at virtual care. Some of the national health systems, that was more of a priority from an investment standpoint than some of the other organizations. Some of the local or smaller hospitals maybe have less of an appetite to invest in broader virtual care technologies. One of the last charts I wanted to share from that Bain report was that telehealth is one of the top 5 investment priorities as we talk to provider organizations. And you can see some of the other areas that are of focus for investment, but telehealth in the top 5 there. When we dug a little bit deeper, this meant enhanced telehealth. And so when we look at enhanced telehealth, what does that mean? Enhanced telehealth, this equated to virtual sitting and nursing that providers are interested in, looking at how can we leverage technology with staffing shortages to address some of those challenges in the hospital in the acute setting, and remote patient monitoring is another use case that came up. So a lot of investment and interest in these 2 areas when it comes to telehealth moving forward. And what do we mean by virtual sitting and nursing? So these are virtual solutions typically in inpatient settings. For virtual sitting, solutions allow one person to observe several patients at a time to avoid falls, self-harm, or elopement. So those are solutions that providers continue to ask questions about, and we're trying to launch some research. We'll talk a little bit more about that. And then virtual nursing, these are solutions, these solutions allow organizations to offer knowledge-based nursing as a remote function separate from bedside nursing. So leveraging expertise from nurses that have been in the force for a long time. Maybe they want to get off their feet a little bit and work from home. There's an opportunity to leverage their expertise in virtual nursing use cases. You can see some of the bullet points. We've launched a virtual sitting and nursing report. We're in the middle of data collection there, having conversations with provider organizations about their plans there. We anticipate publishing in September the report on virtual sitting and nursing. When we look back at some of the responses we saw early in COVID, some of the challenges that providers mentioned were telehealth, of course, at the time. That makes sense. But the other one was remote patient monitoring. So we saw that enhanced telehealth, where RPM was a focus, an investment priority for providers. And we saw that RPM was a challenge as a result of COVID. And that's one of the things that we see energy in moving forward is remote patient monitoring. Currently, this is how we define remote patient monitoring, RPM. So these are solutions that acquire, transmit, store patient health data outside of conventional care settings. So most often we hear about these solutions in the home. This is the definition that we talk to providers about prior to getting feedback or on their experience or talk about the solutions that they might be using. Having said that, if we were to talk to 10 providers, we might get 8 different definitions of what remote patient monitoring might be and where they're using remote patient monitoring. Chronic care is one of the focuses of RPM. You can see some of the hypertension, heart disease, COPD, diabetes. Those are some of the common areas we see RPM is looking to address. And you can see those are some of the conditions that are causing a lot of the challenges we see, increased cost and just a lot of the challenges that we see in healthcare. And so these technologies have potential to address and improve care for a lot of these use cases that you see here. Some of the use cases we see beyond chronic care and COVID-19, post-surgery recovery, potential for early discharge, obstetrics, pre and postnatal care, pneumonia, stroke, palliative care, end-of-life care. These are just some of the other areas that we hear about when we talk to organizations about remote patient monitoring. We put out last year an RPM perception report where we talked to provider organizations and asked, where are you with your program? Do you have a solution in place? Is it maturing? Are you looking to grow? And you can see a large appetite from providers to either grow with their current RPM solution or put something in place and look to expand on their RPM. And again, just most programs are either in that pilot or emerging stage. Not a lot of sophisticated or really mature RPM programs in place at the moment. These are just some potential outcomes that we've seen as we talk about remote patient monitoring, improving patient outcomes, reducing cost of care, addressing workforce challenges, health equity possibilities. Starts to sound a lot like quadruple aim when we look at some of those. And we're still trying to validate a lot of the use cases and outcomes as we look at remote patient monitoring. Here's some of the outcomes that came from that RPM perception report: reducing health system utilization, improving patient outcomes. But again, we're still early in the process of seeing what some of the outcomes are from remote patient monitoring. Let's go back. Some of the things that providers mentioned they're using to support their programs from a financial perspective, of course, CPT codes, but you'll notice a lot of value-based care in that second category there. And then a lot of providers are looking at grant funding and donations to launch some of their programs from an RPM perspective. One of the things that comes up for grant renewals or when renewals are coming up with contracts is what are the outcomes that we're actually seeing from our solution, and how can vendors help communicate that to their customers. So one other piece that's becoming more and more common as we talk to providers is the surrounding services that accompany the software, technology, equipment that might be in the home. So care management, patient-facing technical support, inventory management, even rev cycle services are coming up more and more as a key part of remote patient monitoring offerings. And you can see from just some of the services that where we're seeing more adoption from some of the customers. Patient-facing support is something that a lot of organizations are asking for, given some of the challenges from a staffing perspective. Some organizations don't want to handle device management and cleaning devices, sending them out, and so having vendors help with that. Of course, care management and billing, and you can see billing is still a little bit lagging from a service standpoint when we talk to what providers are actually using from vendors. So again, just some of the things that are leading to some of the excitement we see from remote patient monitoring. We mentioned, that enhanced telehealth being an investment priority, RPM being part of that. And visibility is part of the excitement we see from RPM. One thing about the market that we've noticed as we've talked to providers is there are a lot of solutions out there, and organizations are taking a lot of attempts at their RPM programs. What should we use? We mentioned earlier that they're looking at existing solutions to look at their strategies, but we ended up having 58 providers that mentioned they were looking at different vendors, and 59 different vendors came out of those 58 conversations. So a lot of noise in the market, a lot of different types of solutions. So we're still kind of early in validating the types of solutions and different use cases and the vendors that are involved. A lot of opportunity for providers to get lost in the weeds, but also a lot of opportunity for vendors to come in and offer a solution and drive outcomes. This is just a sense of the types of vendors that were mentioned in those 59. You can see a lot of those broad RPM or focused RPM solutions, but a number of different types of vendors were included in those 59. So providers aren't exactly, we mentioned the definition of RPM. Even with that definition, we saw solutions brought up from virtual care, EMR, other areas as well. Just some of the features and functionalities that providers mentioned they would like to see from their RPM vendor: integration, ease of use, functionality. These aren't necessarily surprises, but we did validate that those are things that providers are looking for as well. AI is something that comes up. This feels more like an aspirational ask than a current view on where we are with RPM. As you walk around the conference, you probably hear a lot about that, but in practice, we tend to validate less of that than we do talk about it kind of in theory, at least at this point. I anticipate that we will continue to hear more about that moving forward. The road ahead. So here are some things that we need to clarify or continue to build out in order to see RPM growth continue to move forward. Reimbursement, of course, that's a huge question. What does that look like moving forward? Can we move from fee-for-service to value-based care? Those are some questions that providers are asking. Can we get vendors to help us roll these programs out? A lot of times providers aren't exactly sure how to do it. Do we have staff in place? Do we have the expertise? And so how can vendors help guide that process? And some things that are currently evolving, continuous monitoring versus episodic. We see a lot of questions around that. RPM for health equity, RPM and hospital at home. I would say some of what we're seeing from a patient engagement standpoint also bleeds into that. And then expansion of use cases. We see providers oftentimes using solutions in ways that maybe vendors didn't intend. And so what does that look like moving forward? Device connectivity, is it cellular, is it Bluetooth? What are some of the needs of the customer? Those are some questions that we see. And then consumerism is kind of the last point. I see some of us have watches on our wrists. We're getting health data potentially right now as we speak. What does that look like for consumers and patients moving forward? How do health systems and vendors incorporate some of that data into their programs moving forward? So anyway, these are some of the things that we talk about from a virtual care standpoint. We mentioned a lot of different things from outpatient video that patients want to see, acute solutions that providers are asking a lot about given the challenges they see from staffing, remote patient monitoring in the various use cases. These are some of the questions that providers are asking moving forward, and why we talk about telehealth as a necessity, moving into that strategy component, and how are they addressing some of these challenges, and as they address these challenges, are there solutions that can help across the board, or do they need to continue to look at point solutions as they move forward in virtual care? So anyway, thank you for your time. Any questions that I can answer, or if not, we can connect after and talk, and thank you for your time.